Hello, my name is Rain A. Buenaventura, and today I'll be explaining you the symptoms, causes, and treatments of COPD or chronic obstructive pulmonary disease. So let's go to the content table first. Table of contents. First off, we will be explaining what is the CPD. Next is symptoms of OCPD, causes of OCPD, and then the treatments for OCPD. So what is COPD? Chronic obstructive pulmonary disease, commonly referred as COPD, is a group of progressive lung diseases. The most common diseases are emphysema and chronic bronchitis. Many people with COPD have both of these conditions. Emphysema slowly destroys air sacs in your lungs, which interferes with outward airflow. Bronchitis causes inflammation and narrowing of the bronchial tubes, which allows mucus to build up. Diagnosis usually involves imaging tests, blood tests, and lung functions tests. Sadly, there is no cure for COPD, but treatments can be help ease any symptoms, lower the chance of complications, and generally improve quality of life. Medications, supplemental oxygen therapy, and surgery are some forms of treatment. If it's not treated immediately, COPD can lead to a faster progression of disease, heart problems, and worsening respiratory infections. So, next is symptoms of COPD. What are the symptoms of COPD? COPD makes it harder to breathe. Symptoms may be mild at first, beginning with intermittent coughing and shortness of breathing. As it progresses, symptoms can become more constant to where it becomes increasingly difficult to breathe. They may experience wheezing and tightness in the chest or have excess sputum production. Some people with COPD have acute exacerbation with a flare-ups of several symptoms. At first, symptoms of COPD can be quite mild. You might mistake them for a cold. They might start making subtle changes such as avoiding stairs and skipping physical activities. Symptoms can get progressively worse and get harder to ignore as the lungs become more dangerous or damaged. But in later stages of COPD, symptoms may also include fatigue, swelling of feet, ankles or legs, weight loss, and immediate medical care is needed if they have bluish or gray fingernails or lips, as this indicates the low oxygen level in their body. They have trouble catching their breath or cannot talk. Their heart rate is rising. Symptoms are most likely to be much more if they are currently smoking or regularly exposed to a secondhand smoker. Now next is what or the causes of COPD. The top cause of COPD is tobacco smoking. Long-term exposure to the chemical irritates can also lead to COPD. It's a disease that usually takes a long time to develop. The longer and more tobacco products you smoke, the greater your risk of COPD. In addition to cigarette smokers, cigar smokes, and secondhand smoke can cause COPD. The risk of COPD is even greater if you have asthma and smoke, but COPD isn't contagious. Next are the treatments for COPD. Treatments can ease symptoms, prevent complications, and generally slow disease progression. Your healthcare team may include a lung specialist or pulmonologist, and physical and respiratory therapists. So, number one, medication. Bronchodilators are medication that helps relax the muscle of the airways, widen the airways so you can breathe easier. They're usually taken through an inhaler or a nebulizer. Number two is oxygen therapy. If your oxygen level is too low because the cause because of the cause of COPD, you can relieve receive supplemental oxygen through a mask or nasal cannula to help you breathe better. A portable unit can make it easier to get around. The number three, immediate surgery. Surgery is reserved for severe COPD or when other treatments have failed, which is most likely when you have formed a severe emphysema. One type of surgery is called bulimectomy. During this procedure, surgeons remove large abnormal airspace or bullae from the lungs. Another is lung volume reduction surgery, which removes damaged upper lung tissue. And lastly, lung transplantation is an option in some cases. And lastly, number four, change of lifestyle. Certain lifestyle changes may also help alleviate your symptoms and provide relief. If you smoke, quit. Your doctor can recommend appropriate products or support services. Second, whenever possible, avoid secondhand smoke and chemical fumes. Third, get the nutrition your body needs. Work with your doctor or dietitian to create a healthy eating plan. Lastly, talk to your doctor about how much exercise is safe for you. So this is the reference that I use for this presentation, and thank you for watching, and I'll be seeing you in the next PBA or presentation. Bye! Thank you for watching.